Hi, Dr. H. My name is Corey Sicky, and I'm answering your question that you gave to us in regards to how would we or how might we work with an individual who comes with us with delusions that are of a religious nature. So this is a very loaded question for me personally, because of some experiences that I've had with my daughter. So several years ago, we had experienced some afflictions with my daughter by demonic spirits. And prior to that, I've been a person on the fence, leaning more towards psychological explanations. However, we did bring it to our pastor, and our pastor met with myself, my husband, my daughter, and we witnessed a deliverance of a demonic affliction that was going on with my daughter. So, with that being said, coming at this from a clinical standpoint is a little challenging for me. I do not believe that that is the case with everybody. And I do know that with my daughter, there's still some psychological components to what she was struggling with and continues to struggle with. But I do also recognize that there was clear evidence for a purely spiritual component to her to the voices she was hearing and the delusions that she was having, because of the deliverance that we have seen. So going into the clinical side of things, though, I did some research, and it was interesting to me that I found that in particular, delusions, psychosis related to religious components are a lot more difficult to treat. They are a lot more difficult to see a relief in symptomology and to see any positive ground being made in treating individuals with religious psychosis. So I thought that was very interesting, and also caused me to reflect upon my daughter and wonder if there's a spiritual component that we are missing to all of this. But on the other side, I am a proponent of CBT and ACT in particular. So the article that I read dealt with those two therapies, and how they have been used in dealing with religious psychosis. I found that CBT was effective, but ACT seemed to be more effective. Still not 100%. There's still a lot of research that needs done. But the acceptance and commitment therapies seem to be fairly effective with these individuals in helping them to recognize the voices, the delusions, and then not allowing them, being able to just let them go and commit to how they want their life to go, their actions to be, and them being able to function socially and not allow the positive symptoms to influence their behaviors. So I very much agree with that, helping individuals to recognize that this isn't something that needs to affect them on a daily basis, and recognizing that, and also in a faith-based way, going back to CBT, challenging some of those thought distortions, and if they're hearing voices and the voices are saying things that are contrary to God's word, being able to point that out to them, and helping them to recognize that these voices that you're hearing, it goes against God's word and what it says, and how do you want to live, and how do you want these to affect these behaviors. So it's a very complex topic, obviously, but I thank you so much for bringing this out. It gave me a chance to do a little bit more research, which I will continue with, absolutely, to try and bring my personal experience in line with the clinical evidence. And so thank you so much.